and then we'll have time at the end for discussion and questions. So let me start by introducing you to Sinai Urban Health Institute, or SUHI, and the work that we do. We're the community-based research and evaluation arm of Sinai Chicago, which is the largest private safety net health system in Illinois. This means that we work in communities that often face some of the most significant health challenges. But we also see incredible strength and resilience that we draw on in this research. We also do community health worker interventions and training and community engaged evaluation services. Our vision is a simple one, but it's pretty powerful. We really just want all communities to thrive in health. And our mission is to eliminate health disparities through excellence and innovation in data-driven research, interventions, evaluation, training, and collaboration. We're proud to be one of the largest and oldest non-academic health equity research centers in the country with a team of about 60 staff. Everything we do is in partnership with the communities we serve. We recognize that health doesn't just happen inside hospital walls. It's shaped by everything from housing and food access to relationships and neighborhood resources. My own journey at SUHI has spanned 8 years, leading our evaluation work and working alongside some amazing team members. In that time, I've learned a lot about the power of collaborative evaluation, and I'm really excited to share one example of that with you today. So before we get started, we wanted to do 2 quick Zoom polls just to see who's here with us. Anna, maybe you can go ahead and launch that. Okay. So take a second, tell us who you are. And then Anna, whenever you feel ready to show some of those results. Okay, I don't know if everybody can see it, but it looks like about half of folks are from a safety net institution. Then we have about a fifth are from other, some health department, healthcare, academia. So thanks for that. And then we have one more poll about what kind of work you do. And then Anna, feel free. I think you can maybe see the numbers coming in. So whenever you feel like it's the right time. Oop, those disappeared before I could see it. Oh, there we go. And it's gone again. Okay. About a third are in research, some healthcare policy, about a quarter in program development, other. So we have a really good mix of people here today. That's exciting. Thanks again for joining. So as we jump into this webinar, let's consider this question. What can go wrong when important voices are not involved in planning, implementation, or interpretation of findings? Take a few seconds. Think about a project or evaluation that you've seen or been part of where not everyone who should have been involved was. If there is a chat feature, I'm not sure if there is, you can go ahead and throw something in the chat. If not, think about it. Here are some things that we see happen all too often. Misinterpretation of findings. So imagine that you are reporting on why a program didn't work, but you don't realize there was a local barrier, a cultural difference, or a resource gap that the numbers didn't capture. Without community voices, our data can really lose its meaning. Maybe your survey asks a question that doesn't apply or make sense to the population. Maybe you ask about experiences using local transportation to get to a doctor's appointment, only to find out later that the bus lines or the train don't go through those neighborhoods. If the population isn't involved in designing tools, we might be asking the wrong question. A big one is community losing trust in you. If people feel like decisions are being made about them and without them, it can really break down that trust quickly. And maybe participants don't agree to join your focus group or don't show up. When recruitment methods, scheduling, or even the topics don't respect community realities, people might not attend. There's a really great meta-analysis, I just have that up here, from some researchers at the UCL Institute of Education in London that reviewed the effectiveness of community engagement in public health interventions with a focus on groups experiencing disinvestment. The big takeaway is that community engagement has a statistically significant positive effect on health outcomes, health behavior, self-efficacy, and perceived social support. One example is from a study where a child obesity prevention program was implemented in nearly 100 schools in Texas. In some schools, they implemented the basic intervention. In other schools, they implemented the program plus more intensive community engagement components. Among schools that engaged community, there was an 8.2% decrease in overweight and obese students compared to just 3.1% in schools without that added involvement. But this isn't the only example. All of these studies compared interventions that did and did not engage community, and all of them found better outcomes when community was involved. Less asthma-related hospitalizations, increased screening rates for alcoholism, increased use of parks and green spaces, the list goes on and on. We're really seeing a changing landscape and evaluation, specifically with more focus on equity, accountability, and community relevance. Engaging the community isn't just nice to have anymore, it's really essential for meaningful evaluation. Over the years, we've seen evaluation practices evolve. Traditionally, evaluators set the priorities, design the tools, and control the data. Populations were studied, but not necessarily consulted or part of the process. These evaluations often focused on what the funder or research team cared about, used more traditional methods, surveys, program counts, and most decisions about what questions to ask, how findings were interpreted, and how the data would be shared were filtered through the lens of the evaluator or the organization that asked for the evaluation. The goal was often publication, academic advancement. I don't know if anyone here has heard the term helicopter evaluator, or if you haven't heard of it, you'll know what it is once I describe it. It's a term used to describe an evaluator or researcher who lands in a community just long enough to gather data and then disappears, taking the results with them and leaving very little behind that actually benefit the people who contributed that data. It's a model that can really erode trust in communities and limit how useful our work is. On the other hand, community engaged or collaborative evaluation really flips this approach. Here, community members and evaluators work in partnership. The evaluation is shaped around what matters most to the community itself, or analysis is informed by local perspectives and context. We see much more creative methods, not just surveys, but maybe stories, oral histories, and data gathering strategies that are developed together. Data and results are shared, and the ultimate goal is not just to publish findings, but also to inform action, improve lived experience, and meet the real needs of the population. There's no one way to think about collaborative evaluation. There are lots of models and frameworks out there that help us think about how to do this work. Here you'll see just a few of those. At their core, all of these conceptual frameworks emphasize the importance of intentional partnership, sharing power, actively valuing community knowledge and leadership. They move us away from doing to or for communities and much more towards doing with communities. But there are some differences. Some models show a continuum from minimum consultant to full community ownership. Then others look at this as more of a cyclical process with cultural competence guiding the continuous steps of engaging community from defining questions all the way to sharing results. Some focus more on the outcomes rather than process. Regardless of the model, they're really all trying to communicate the same thing, that moving from no community involvement to more of a reciprocal partnership can make the work stronger. You've probably heard the phrase, nothing about us without us, and that really gets at what we mean by collaborative evaluation and why we're here today. So why does it matter? Why is it worth the extra effort, coordination, time? First, when we center the perspectives of people directly impacted by programs, we tend to have better data quality and relevance. It's also so much more feasible for making an impact. Instead of designing solutions for communities, we're co-creating solutions with communities, making sure that the findings reflect actual local needs and values. The second one is building trust, buy-in, and lasting capacity. When communities see themselves as partners, not just as subjects, it really changes the relationship. We see deeper trust in funders, program staff, evaluators, researchers, and greater buy-in and support for newer approaches. It also can help with capacity for sustainable change even after funding ends. The third one is coming up with new solutions and being creative. Collaborative evaluation brings out knowledge that might otherwise be missed. Community partners often understand things and kind of can spot issues and opportunities that external evaluators may not be able to see. It leads to more actionable and innovative findings and new investment priorities. The fourth thing is reducing waste. Sometimes we've all seen it. Programs stumble, evaluations don't quite work because you didn't understand something. We didn't know how to ask the right question. So by involving communities from the start, we can really avoid some of that waste, minimize missed opportunities, and make sure that resources are directed in a way that is aligned with what's actually doable. And then the last one is advancing equity. If we're committed to equity, inclusion, and sharing power, not just saying it, but actually doing it, then it's really important to engage with community and making sure that we're moving towards that impact. So I've spent the past 10 minutes or so trying to convince you that collaborative evaluation practices are worthwhile, but I suspect I don't really need to convince you. I think you're really all here because this is something that's interesting to you that you want to learn more about. And so we are here to hear some great examples. Today's presenters are going to take you beyond some of the theory that I talked about into practical stories. So some things to listen for: how were partnerships formed? What role did community play? What were some barriers and lessons learned? And then impact and actionable strategies. So throughout the presentations, think about those things. Please feel free to drop questions into the Q&A section. We're going to have some time at the end to do that. And so now I'm going to introduce our two other panelists today, and then we will kick off presentations. So first we have Dr. Chris Parker, a director at the Georgia Health Policy Center and research assistant professor in the Dean's Office of the Andrew Young School of Policy Studies at Georgia State University. Dr. Parker is a health systems strategist, researcher, and policy analyst with expertise in applied health program planning, implementation, and evaluation. His portfolios of work focus on mixed methods research and evaluation aimed at providing diverse stakeholders with information and data to problem solve complex health policy challenges. He's helped to build the center's work with state policymakers, health agencies, and systems in Georgia and across the country. Our second case study will be by Dr. Kelechi Ibe-Lamberts. Dr. Ibe-Lamberts is a clinical associate professor in the Community Health Sciences Division and an affiliate faculty in Black Studies at University of Illinois, Chicago. He also leads the Transnational Research and Practice Lab, where his research examines the influence of culture in community health from a transnational perspective through community-engaged research. He was born in Lagos, Nigeria, and immigrated to the US at age 8, growing up in Chicago. Outside of academia, he mentors students, advocates for minority health initiatives, hosts the My Black is Transnational podcast, and produces UIC's community level podcast, and is a proud husband, father of 3, and Chicago sports fan. So I'm very excited to hand the mic over to our first presenter, Dr. Parker, to get us started.
Thank you, Jackie. I appreciate that. I appreciate the opportunity to be able to have this conversation with everyone today, this issue of community engagement in evaluation. I know sometimes when we come to these events, with the senses that you're going to hear from the experts, I'm showing up today hoping to learn. And in fact, as you will see or hearing the presentation, I chose a couple of evaluations that we've been engaged in where I think we've probably been hoping that we're doing the right thing and learning that there's still more that needs to be done. So I'm going to start sharing my screen, and my ask is that as I go through the next couple of minutes talking with you, that you be thinking about how some of the experiences that I had are either similar or dissimilar from yours, and then what we might be doing differently to ensure that this concept of nothing about us without us is more than just a nice saying, and that we're actually living it out in the work that we are doing. So let me go ahead and start sharing. And this was easy the last time we did it, which was in preparation. Let me start from the beginning here. Thank you for your patience. Not seeing anything on my end. Are you seeing screen on your end?
We did see it, and it looks like when you put it into presenter mode, now we're not seeing it anymore.
All right, well, you guys go ahead and share.
Oh, because I think it's at the end.
Yeah.
If you go back to the first slide and reshare.
Oh, that makes
There you
sense.
go. There you go.
Simply enough. All right, so having had the opportunity to see all the slides, you realize that I won't be on for too long. So as you heard, I am a public health practitioner, a physician by training, and I've been at the Health Policy Center for 23 of the 30 years that the center's been around. And I wanted to just quickly kind of say a little bit about how we see and view evaluation at the Health Policy Center. The triangle that you're seeing is really our mission, our reason for being, this idea of trying to promote health at the level of communities across the country, and indeed more globally, by doing policy research and programs, being engaged in implementation, evaluation, and translation of research and evaluation for communities to improve their health and well-being. I can say to you that the way in which we have kind of gone about this is that we've been focused on evaluation that's of maybe 4 types: developmental, outcomes-based or outcomes harvesting, realist, and then as we have grown over the last couple of years, really trying to ensure that it's not just community-based, but community involved. And we'll unpack a little bit more about what that involved means and what it's all about. I will tell you we're an academic center, and so for that reason, there's always some thought or consideration about not just where we're going to publish findings, and in fact, I will tell you personally that does not necessarily excite me, but how are we able to disseminate findings in a way that the field learns, and maybe sometimes that's a peer-reviewed article, other times it's not. And I'd say most often with community work, it's actually being in the space and places where community members are, where community-based organizations are, where folks are joining action to try and make a difference, to be able to share what we're learning together. You're seeing the CDC framework on your screen, and that's the kind of rigor that we hold to. This is one version of it. It's evolved over time, but this idea of these steps in the evaluation process, beginning with the engaging of all of the stakeholders, and I dare say that's not just a beginning, it really should be a thread throughout. And then getting into some of the other details of understanding what is the nature of the intervention or the program, thinking about what the design might be, getting the evidence, justifying your conclusions, and then thinking about how you're going to share that. That's when you strip the evaluation of all the fat. At the core, what you're trying to make happen, or what we've been taught, is the way in which we make this happen. And we still, to a large extent, keep that in mind as we are thinking about the way in which we go about evaluations. Today, though, I want to focus in on some work that we've been doing with a couple of health systems. And I haven't named them. There are 2 in particular with national prominence that have been focused in on providing resources to sites across the country. In one instance, it's a health system that has kind of regional health ministries, and they have community collaboratives that are spread out across the country, 9 of which are doing this work around transforming communities. It's called the Transforming Communities Initiative. The other has focused in on providing resources to 30 sites across the country, aimed at addressing this issue of inequities that exist by allowing those communities to kind of understand and then define the inequities that have been challenging their existence, and to think about how with those resources they might be able to kind of make system level change. So you'll see there that the focus has been on this issue of health and racial inequities, major focus. So you're talking about complex community change that doesn't happen in 2 or 3 years. And that some folks are focused on the vital conditions of health and well-being, which you're seeing on the left side, and others are actually kind of focused in on those urgent services that become needful when you haven't been paying attention to the vital conditions. So the approach in both of these instances is that there is a way of thinking about what are we learning as a whole initiative, and then what are we learning at the level of the communities that are engaged. The methods I've listed here, they're important, and yet at the same time, what I wanted to be able to say is that we start out with this slew, this menu of here's what we're thinking, and then that's usually brought to a group of stakeholders who invariably have thoughts about whether or not that will or will not work for either the enterprise level evaluation or the site level evaluation itself. So we do the usual kind of review of documents, whatever it is that folks have been putting out there. We spend a lot of time having conversations and key informant interviews. We use focus groups often, in some instances, kind of charrettes, or being able to have conversations in the community itself. And then the surveys of people who are partnering to make the work happen, just to ensure that we are complete in terms of understanding all of the stakeholders and the views that they bring to the work. I want to highlight that part of the evaluation approach is always around using small groups to make sense. And the small groups invariably are, I will say, they vary depending on where it is that we're doing the work, but they're invariably made up of community members, the collaborators and partners in the work that they're doing, and oftentimes folks who are also providing like technical assistance to these groups, just to try and ensure that the voices that we're hearing, and we're hearing all at the same time, are the people who are in the throes of making the work happen. One of the things which I think has been very helpful to us is this idea of establishing a group that's advisory to the process. And advisory sounds like, it's really formal. In both of these instances, the folks who've been a part of that group are the movers and shakers within the community who are signed up, who've been provided resources to make this happen. And those resources, at least in one of those instances, is such that we are providing for local evaluators. So we recognize that, especially if we're based in Georgia and we're doing community work somewhere in the middle of Ohio, that we are from away, and that the credibility that we might have on the ground and what we bring to the evaluation itself is not likely to be the same. We recognize even here in the state of Georgia, universities are seen as one of the purveyors of what was previously mentioned, where research is done to, and then folks retract from the community. So it's very extractive. It's not who we are, but we recognize that we are oftentimes seen in that way. And so this idea of engaging local evaluators, hugely important to now say some more as we move through this presentation. The co-creation of a logic model, try not to use the term logic model. So we talk about the theory of how change will occur, and sitting together with community members to design the evaluation. We start out invariably with a scope of work for the funder that invariably says, yeah, all of this will likely change after we've had opportunity to kind of engage community making things work. And there may be a conversation about that process as we go into conversation. We use that group to support the engagement of others within the community. They are the ones who are oftentimes shaping the protocols and the questions which are asked. We see ourselves as almost staff to the group in an effort to try and present to the group itself what it is we think we're hearing from them, and then going out into the field to make the work happen, sometimes with, but oftentimes not enough with some of the folks there. And I'll say a little bit more about that when we have discussion. And then there are always the folks who are recommending change over time. In just one instance in this work, we actually shifted our focus in the evaluation because of the reaction. There was technical assistance that was being provided in a way that I don't think the community thought was helpful. We were pretty much asked to kind of hear from the community about what that could be, what should happen. And right in the middle of the work, we helped to change the way in which that technical assistance was delivered so that it was more community focused and driven. Wanted to highlight the kind of charge and charter that was put together by, in one group, this advisory group, that laid out the details of why they existed, how they were likely to interact with everybody else in the work, What were some of the deliverables? And I have circled some of the kind of areas that I wanted to just kind of quickly highlight. One, that it was set up in some ways perpetuity. As long as the folks thought there was a need, that this group was established to make the work happen. Two, that there was compensation, that there was an agreed upon amount that would go to each of the collaboratives by virtue of participation of representative members. And these are national models, so it should be interesting to hear when Kelechi speaks a little bit more about what might have happened more locally. That they recognize what their focus ought to be, and that at the end, this decision-making authority was really, in some ways, I was very impressed with the funder, deferring to this group so that community voice was seen to be more important and more powerful than the kind of funder's leadership of the initiative. A slew of questions here. I don't expect you to go through all of them, but the idea here was that we wanted to ensure that we had periodic episodes of checking in, ensuring that we were still on track, that the engagement was what it needed to be, and that if we needed to make modifications, that, you know, before the next kind of year, we would have the information that we'd need to do that. And so we had this process, and we still have this process, by which we are continuously trying to evolve the work in a way that gives more voice, more meaningfulness to the folks who are doing the work in the communities and trying to make it happen. You saw a quick glimpse of this when Jackie shared. I just wanted to highlight that for us, I think a lot of the work that we do in these two pieces of work and even beyond, in the almost 25 years that I've been at the center, we've shifted from this process of consultation more toward collaboration. This challenge of deferring, if we're talking about justice model created by Gonzalez, this model, this deferring to the community, I don't think we're there yet. And we may have a conversation about what that could look like, should look like, and where it might be more appropriate for that. But I have watched as we have kind of gone from this place of just doing a few focus groups here to try and ensure that we understand what the voice is, to now really get into that place where the power of defining, we've had folks who said to us, Chris, yeah, so that report cannot happen by December. We who are doing the work, we'll tell you when it's time for us to be able to make that report happen. And we've had to be nimble enough in the evaluation process to hear that, value that, and to act on that. So as I close, I just wanted to kind of highlight some of what we're learning specifically around some of these challenges. I don't think there's always enough resources when people think about the evaluation of a body of work. Clearly, more resources are always provided for implementation. And there's never enough, I think, to make all of the work happen in the way that it should. And so that sometimes is a barrier to really engage in the community. The funder's philosophy and the expectation of change and the pace at which change occurs sometimes gets in the way. This third one is kind of interesting. The fact that when we say community, we don't always mean the same thing, and that power and voice within a community isn't always monolithic. And so how do you navigate communities where there may be differences in opinions in terms of process and how to move forward? This challenge of, is a community-based organization really a good proxy for the residents themselves? I know that we've run into that in a couple of the evaluations that we've done. And then the idea of fatigue. Sometimes with the model that is asking so much of community members, we're not always paying attention to the fact that there's a full-time job often, and then there's an ask to be a part of this other work. And that's why we've really focused in on this idea of ensuring that folks have the right honorarium or payment for their involvement in this work itself. So I recognize that we don't have a lot of time to do deep dives, but I look forward to a conversation about some of the work that I've been engaged in. And I really do look forward to learning from you in terms of what's been working well and what we might be able to do differently here at the center. Thank you for your time. I'm going to quickly pass things over to my colleague Kelechi, who's going to share a little bit about some of the work that he's been involved with in Chicago.
Thank you so much, Dr. Parker. Hello, everyone. Good afternoon. It is a pleasure to be here and to be able to talk about the work on behalf of my team and my partners when it comes to just exploring oops, sorry, my camera. I need to get that on so you can see my face. All right. So, yeah, I'm here to talk a little bit about the work behind participatory evaluations. I'll first just also I give a special shout out to Nancy Valentine, who is here as well, and I'm speaking on behalf of the team, but also she'll be joining us for the Q&A sessions to share a little bit of perspective from the community angle regarding the work we were doing. But I quickly just want to cover this in regards to just the work we were doing. We were able to work with CDPH and just evaluating the health equity initiatives that they had. And two major ones were the Healthy Chicago Equity Zone, which I'm sure many of you are familiar with, and also the Health in All Policies, also known as HEAP. And our goal was just to really try to see how we can enhance the capacity of CDPH, the city of Chicago overall, and the community-based organizations to promote health and racial equity, addressing structural racism. And we know what the impact of the health equity zones is and what it could potentially be if we were able to just clean some things up and really understand the impact that it's having. And even in regards to health and all policies, really trying to see how we can be able to continue to help it facilitate power sharing through transformative community and government partnerships. So I'm going to go over these a little quicker just because I really want to get into the nitty-gritty. So our evaluation approach was really developmental and participatory. I'll talk a little bit about what that looked like. And then our focus was really trying to learning what will lead the program improvement and sustainability. We implemented a mixed method approach. We did some in-depth interviews, and then we also had some surveys distributions. We did some document reviews as well. So this was a very huge undertaking for our division, community health sciences. So we were able to really have three major work streams. One was the qualitative subgroup, where we were able to conduct those in-depth interviews with key informants. We were able to also do some document reviews and some key document meeting minutes and other notes and briefs that were put together, regional meetings and community-led meetings. We were able to look at the documents and see what potential impact specifically HCZ was having. HEAP didn't really have as many documents compared to HCZ. So HCZ kind of fell a little bit more took a little bit more of the shine, I would say, compared to others. And then we had weekly meetings with CDPH and biweekly meetings internally with the team. And then we also had quarterly meetings with our advisory groups. Our advisory groups were comprised of people from all over the 6 regions. We met with them, and they were essentially here to help co-develop the program theory and logic model. We also worked in tandem with them to co-develop the evaluation research questions, which I will talk a little bit more about. We met a total of 6 times, and we were able to, through that process, really learn a lot. As I mentioned, we had all these different organizations from all across Northwest, Southwest, far South, and it was very engaging and very informative to be able to have these partners join us during that process. So our findings for this evaluation: we learned about HCZ and HEAP, 600 new threatened partnerships, 90% of the CBOs reported new useful skills. We talked about 85% of CBOs who reported growing levels of mutual trust with CDPH. The priority areas we were able to identify were behavioral and mental health, focused on chronic diseases, and also, though, with all of that being said, we still also were able to acknowledge that sustainability is always a concern. And so some key takeaways that I want to highlight are: one, growth and trust among community organizations and between communities and cities is evident, but it has been slowed by these structural barriers. So despite the fact that there is trust, still a long ways to go. The involvement in HCZ initiative definitely led to more and more organizations to adopt new health equity goals in their long-term work plans. But again, when it comes to sustainability, now is still a critical moment for sustainability when it came to HCZ related work. Now, I know that I just breezed through all of that, and that was intentional because that didn't want to just give you the standard methods, overview methods, results type of presentation. We came here to talk about collaboratory evaluations, and I really wanted to be able to provide a peek under the curtains of what that process really looked like. And it wasn't just, your standard procedure. This was a true journey for all of us involved. There are multiple institutions that were involved when you're talking about UIC and CDPH, and we had to deal and overcome a variety of things. The first thing was just our sense of urgency. We had to come together and realize that we were both moving kind of fast, and we had to learn about how we can move in what we say, the moving at the speed of trust. We both had our own internal timelines of when we wanted to do things. We both felt pressure. We had to do this evaluation in 2 years, and CDPH had their own timelines for when they needed reports in, and we had to be able to figure out how can we really get this done right while still acknowledging that we have these deliverables and these timelines, that we had to take time to continue to meet, to continue to negotiate, build trust, and say, hey, I may not be able to get this to you at this moment. Is there room for flexibility? And how do we speed things up on our end to make sure that we're giving you what you need for your reports? So it took constant and iterative conversations over time to be able to get to that point where we can be able to move collectively together. And then the next thing was just trying to figure out what is the true purpose of this work. So in the middle of us trying to understand and address our sense of urgency, we were trying to get all of that done while still thinking about what the real work was, which was the evaluation, and not necessarily taking into consideration that us building this trust, building this partnership with ourselves and even with our advisory group and community partners and regional leads and community leads, that was part of the work. That was not just, perfunctory, obligatory things that we needed to do. This was part of the evaluation process as well. And acknowledging that while working with our community partners, our community leads and regional leads who were part of our advisory groups, there was a range of emotions that we had to deal with. And when I say that, we had to acknowledge and accommodate that some felt joy, some were excited, some were anxious, some were concerned and worried, right? Because we had to also consider a lot of the power dynamics. We know who's signing the checks, right? And we know what that might look like. So it was very important for us to put all that on the table and just figure out what are we really trying to accomplish, not just in the short term, but in the long term. So it was a very complex thing because trying to capture power, grassroots initiatives, it's not a straightforward process. It's a very complex thing. Right? And then we had to be able to just figure out what is essentially the priority one step at a time. So these were some of the key points that just to kind of overview some of the ways we were able to, take action in being able to address some of those, not barriers, but some of those main issues during the process, right? So being able to schedule those weekly check-in meetings, and when it came to being able to reach shared conclusions, that was a very important part as well, because when it came to developing our program theory and our logic model, we had different languages. We had to be able to come to the same page and being able to translate what things meant for us from an institutional standpoint in terms of UIC and the language we use compared to CDPH. So when it came to developing the program theory and the logic model, we had to have a shared language that was developed in order for us to be able to move forward and collectively create that. And then including our partners as well, community leads, understanding that when it came to this was essentially what we developed, and I'm moving quicker just for the sake of time, but being able to come and create this took so much time in terms of and so many versions that we were essentially able to just show and check in frequently and say, does this look good? Does this make sense? Does this sound like what you all are saying, and vice versa? And they were able to translate and say, no, this is what this means and this is what that looks like. And it even reached the point where when Dr. Tiffany Ford, who essentially, put the program theory together and led that task, when she was done, I mean, it led to a standing ovation because it just took so much. It was such a relief that we were able to finally get to that point of consensus and agreement between all of us, or among all of us, I should say. So that just spoke to just the work that was happening, and even when it came to just developing our program theory and what it looked like. And I've kind of covered, how we went about that process. But then when it came to our advisory group, our advisory group, I think innately, the natural behavior when working with advisory group is to kind of just come to them and try to, you want to co-develop, but instinctively, you're looking for feedback. And one of the major things that we learned in our process, in addition to developing the community contract, which kind of helped guide our meetings, when we brought our evaluation questions, we initially were coming in with the mindset of just getting feedback. And we had to essentially have a conversation together with our community leads and regional leads, say, no, like co-development is not just solely feedback giving, right? It's about also the insight and being able to get some understand the fears and to figure out what the benefit is, right? I always want to give a special shout out to Dr. Joyce Chapman, rest her soul, during this process, one of the main people to really just speak outwardly and loud about it and say, like, what does this benefit all of us, right? Instead of just being a check box, and really just warning and kind of creating that awareness that it's natural for us to want to just check these boxes when we're talking about doing evaluations, but truly, what is the benefit in this whole thing for the community partners that are involved? And so when we developed our evaluation questions, it was important for us to really truly check in and truly take into consideration what our community and regional leads wanted to see and how they wanted to go about how they wanted our questions to truly reflect the experiences of the community leads while going through HCZ and HEAP. So it was very, very important. And those were some of that took time as well. That was, some of the nitty gritty things that we had to really, go through. And then finally, this image here is important because this kind of shows us how we started off. And we realized that other than just our frequent meetings and talking, we always had to try to come in with some type of visual communication tool because we figured that that was one of the ways that we can kind of develop and sustain our shared understanding among all parties involved, whether it was our community members, whether it was our CDPH partners, and even with us internally as a team. So we started off having our own visual products that we would share with our partners. And over time, through constant feedback, constant insight, and co-developing and them bringing their expertise to the table as well, we were able to kind of move from here and transition over time to what I was able to show you all now, which was a product of our shared understanding. So the work in participatory evaluation is it is not straightforward. It is a roller coaster. And I wanted to be able to also give us an acknowledgement to the team. Again, a very large team, one of the biggest undertaking when it comes to a systems change initiative by our division. And it took all of us, entirely all of us and some, to be able to really evaluate that process of HEAP and HCZ. And the work in itself is not always smooth. It is never easy, but it was a learning experience. The challenges and opportunities led for so much growth, and very, very grateful to be able to share that. So thank you all for your time. I'm going to pass this on now back to Jackie.
Great. Thank you so much. I am going to talk through our last case study, and then we'll open it up for questions. So I'm going to tell you a little bit about a project that at SUHI we've been working on for the last 5 years. It's called the Health First Collaborative, and this is, like some of the other case studies you just heard about, is a case study in integrating community voices into evaluation practice. I want to spend most of my time discussing the Community Advisory Council and how we worked with them, but just to provide a little bit of background on how this group came to be, the Health First Collaborative, or I'm going to call it the HFC, was formed in 2020 in response to the COVID-19 pandemic and systemic racism, really noticing this following the murder of George Floyd. The immediate goal at the time was to support replicable, scalable, community-led health solutions at a time when, you remember 2020, we were all locked in our homes. There was a vaccine on the horizon. We didn't know what that distribution was going to look like. And community organizations and clinics were really just trying to pull everything together to respond. The collaborative made it very clear from the start that they wanted to engage and center community voices, and they wanted to have an evaluation partner that would prioritize that. It was really well understood across partners that both the implementation and evaluation needed to be in partnership with community to have the most success. It was really nice to have that grounding. You don't always see that and really feel that importance. So it was nice to have all that shared value. The initial round of grants were made to 3 community health centers that were implementing programs like clinics co-located within community-based organizations, health IT integration, and telehealth for mental health services. And the second grant was made to the Chicagoland Vaccine Partnership, which many of you may have heard about, which was developing the infrastructure of a large network that sought to address the anticipated barriers and facilitators to equitable vaccine access in Chicago. One of the first things we did was build a community advisory council. So we intended to really create a space for community members to share their lived experience and expertise to inform what programs, services, and system level initiatives would most benefit them in their community, and to inform the evaluation questions, metrics, outcomes. And this was exciting for funders who really wanted to establish this body where they could learn from people with lived experience and make sure that we were compensating them for their time. We started recruiting participants in October of 2020 and really prioritized residents of communities that were impacted most by COVID-19. We sent out recruitment materials pretty broadly, and 17 members ended up joining us when we kicked that off in December. They represented 13 community areas and 2 Chicago suburbs, which you can see here on the map. And members brought both their lived experience as community residents, but also varied professional experience working in violence prevention, journalism, substance use, youth development, housing. It was really a broad range of experts. And we met monthly, and participants were compensated for their time. There were several ways that we engaged community members to not just advise, but really help shape the evaluation. So here is just one example is from the beginning, we had, they joined us, maybe 3 or 4 months after the kickoff of this collaborative, was we had them help us design the evaluation questions and make edits. So on the left here, you'll see this is kind of what we put together with some funder input. They were a little bit more detailed than this, but just for the sake of moving along, looking at, these are specific for the Chicagoland Vaccine Partnership. So available resources, were they sufficient? Were they learning? How did the CVP respond to changing community priorities? And what did adequate community mobilization look like? And after engaging with community, we made a couple of changes. So in the red were some of the changes that were made. So they wanted to know more about how the Chicagoland Vaccine Partnership was developed and how they leveraged what already existed in the community to build those partnerships. They also wanted to know how decisions were made. They wanted to know more about responses to community partnerships and needs. And then lastly, it was also important to them to understand, how is this information being shared with the community? Is this just the network where they're kind of distributing information amongst themselves, or are they being broad in their dissemination? Another example was more on the outcomes and impact side of things. So really understanding what vaccine response strategies were most successful, what could be replicated, and then if they achieved the outcomes that they set. And our community advisory group wanted to also add a question about how this work impacted Chicagoland communities. So they really had that lens of community, of lived experience, of not just organization, not just clinics, but what are we seeing at the community level and how that's making an impact. We also wanted to gather quality improvement data from the CAC and see what we could improve in real time. So first, we started with surveys. We really wanted to understand how well we were fostering meaningful partnership with CAC members. We used an existing survey with some slight tailoring to our context, and every 6 months for a couple years, we invited CAC members to complete an online survey. Next, we went a little bit deeper with quality improvement interviews. We did 2 sets of phone interviews with CAC members to get this input. The first round focused more on brainstorming ways to make our virtual meetings more engaging and effective. This was especially challenging in 2020. We were getting used to Zoom, Teams, these meetings where it still felt distant. There were a lot of tech challenges. And then the second round of quality improvement interviews were asking for feedback on our meeting structure, our approach to bilingual participation, how much time folks were spending on CAC activities. And then lastly, we did more in-depth evaluation interviews at the very end after our last survey. We really wanted to create a space for honest, nuanced feedback, listen to people's experiences, and see if we could make changes based on those. So across all of these methods, we just really wanted to make sure we were hearing from members at every stage. So you can see there were multiple points of data collection. And there were some changes that were made. So there were several changes that we made, but I'm just going to highlight three. So first, members let us know that they wanted to connect a little bit more deeply, not just during meetings, but also outside of them as well. So we created a member directory. It had CAC member photos, short bios, and contact information for everyone. And then with their consent, we shared this with other members as well as the funders and grantees. It was really simple, just a directory, something that a lot of organizations have, but it really made it easier for folks to connect. Second, members appreciated all the opportunities for co-learning and collaboration, but they pointed out that we needed to do a better job of getting the word out to the wider community. So to address this, our CAC came together to support an in-person event focused on community dissemination. I have some pictures in the next slide. And then we also held 2 virtual presentations specifically for CBOs to raise awareness and share the work. Third, we wanted to make sure that we had the right approach to language accessibility. People really valued our commitment to providing Spanish interpretation, which we did have, but we were switching back and forth between, we were doing consecutive interpretation, which people said really kind of slowed down the flow. So in mid-2023, we switched to more simultaneous interpretation. So I don't know if you've been to meetings where you can click a button and you can go to another space within the same meeting where there's an interpreter. So at the same time, people are hearing the language that makes sense for them. So these are just some images from our community event. We worked with community members to put stories on these boards, images, lived experience. It was a really wonderful event. So throughout this work, we've learned a lot, both from community partners and the process itself. So just 3 lessons that I'm going to run through quickly, and then I want to get to discussion. First thing is that timing matters, but there's a trade-off in bringing people early. So we invited community members to join us from the beginning, which really built strong connections and gave people a sense of ownership. They felt invested, but there was some uncertainty, there were growing pains, and sometimes it was just ambiguous. It wasn't always smooth, and so you just need to be honest about that early on. You're going to ride through some bumps together, but ultimately I do think it was worth it, and people felt like they were involved from the beginning. Second one that I think has come up is balancing and negotiating competing priorities is really hard. Funders, evaluators, community members, grantees, CBOs, everyone has different perspectives and priorities, and they're bringing those to the table. Sometimes they clash, sometimes they align, and it's just really important to find common ground. And there is common ground. You just kind of have to lean into that and make the space for it. Third, and probably one of our most important, is gather feedback often and act on it. You can't really just push ahead with what you think is best. I think we've seen that across all of these presentations. But if you don't ask for and listen to the feedback, then you really miss an opportunity to make things better for really everyone. It really is worthwhile to be open and responsive to adaptations that's going to make the work better. Really big thank you to our CAC, all of the staff across the years at SUHI who's helped this, the funders. We do have a report that we wrote, and I'm going to stop sharing my screen now and invite our moderator, Helen, for a Q&A. And then also I'm going to invite Nancy, one of our community partners, to come join us. And please drop questions in the chat or in the Q&A. And Helen, maybe I will hand it over to you to get us started.
Great. Thank you so much, all of you. This was, I learned a lot. This is a field I've been in for a while, and I still learned a lot from all of you. So I really appreciate the in-depth presentation on this important topic of collaborative evaluation, and then also the specific examples that you all gave. So I'm going to actually start there because I don't think we've gotten questions in the chat yet. So please start putting those in. But I would love, I know that Nancy just joined us, and I would love to hear from a community partner a bit more about your experience as a community partner, what that was like during this process, and what you learned through that.
Do you mind repeating the question? I was transferring devices.
Yeah, no problem. let's see, as a community partner, what was your experience during this process that you are part of? And when did you feel like community voices were truly heard?
Yeah, thank you. So I kind of grew into a maybe just to give some background. So I was in the Belmont Cragen community when we were doing all of our COVID work, and I was a community member who then became regional lead in the Healthy Chicago Equity Zones that for the Northwest region. And then as I faced out of that, I became a community member again. And so I think through the different iterations of my role as someone with authority and someone who had no authority, what was really exciting was those early days of COVID when really we didn't have a choice but to be shoulder to shoulder and having to work together. We had people from all levels of government and people from the community. Like we were all at the same seat having to um, really think out logistical plans. And so I would say in those early days is when I saw like the highest level of like collaboration as a community resident. And I think, and it was then when uh and I don't know if this is kind of like a cop-out answer, right? But like it was really then when I felt like we were heard the most because there was no choice,
Mm.
right? Like we knew where people were going to be. We knew where people were going to like huddle. We knew who were trusted messengers. We knew who were people that people didn't trust. And so I think in those settings that was like the best. And unfortunately, we've kind of phased back into like status quo. However, I think that there's a lot of lessons to learn when you do like have to depend truly on people for the work that you need to like move forward.
Thank you. Thank you so much. So we are starting to get some questions in the chat, in the Q&A, so I'm going to turn to some of those first. Communities have many voices, and they're not always in agreement. So can each of our panelists and our community partners speak a bit about how you navigate those challenges and how you achieve consensus? Who wants to start?
I can start us because I have an example that was very vivid as you said that question. One of our priorities when I was a regional lead was on housing and what that meant. And one of the things that we were talking about was supporting efforts to create a rental registry in the city of Chicago. So, as you may know or may not know, there's a high rate of children with asthma, and a lot of it is due to the environmental factors in the home. And communities like Belmont Cragen were the environmental issues were not necessarily outside of the home, like they may be in other parts of the city, but they were in the home. And so we were talking to different community leads about what this meant, and half of them said, yes, absolutely, this sounds great. And then the other half said, no, we represent the landlords in our communities for this work. And so like we couldn't agree to something like that. And so it took about like 5, 6 weeks of deliberation of just talking about like what that meant for people. And ultimately we agreed that like we would just say that part out loud.
Mm.
Like this is a very complicated piece that we want to move forward, and here are the things that we're concerned about. And I think just saying that out loud was actually helpful than like trying to pick a side. And so it's very real. And I think housing is one of those things that really brings those tensions to the top. But again, just really saying what your hesitations are is helpful for the community to know.
Yeah, I appreciate that, Nancy. And I have had a few of those experiences, and I think I mentioned it in the presentation, this idea of community voices. So I will say that what's been helpful to us is that for those of us who are working in community, we've also been spending time being formally trained on facilitation and consensus development. I do not like to have to take things to vote in any community, because invariably there are winners and losers. And so this idea of how to help folks have conversation when you're able to say why you believe the strategy or the direction ought to be what it should be based on information and data, and then to be able to say, all right, so what am I missing? What is my colleague saying? And so while we're evaluators, we're also sometimes in the space of facilitating these conversations or bringing in the individuals within the community who have that kind of credibility to be in that space to help to get to that place. The other thing that we're often trying to make people aware of is that we don't always have to go in with a zero-sum game. It's not always that your way or my way. There's probably a way for us to be having conversation that both things are important to the community. And we may just need to think about what is the sequence or order in which this occurs. But being able to forge those conversations, if it's us, it goes back to what Kelechi was saying, it takes trust. If we're from away, we don't have any credibility standing in front of a room trying to tell folks what they should or shouldn't do. So being aware that you're not always going to get unanimity of voice, though it's one community, means that we probably just have to be dedicated to thinking about what are the strategies, what are the principles that we can all agree on. It's no different from kind of what happens normally in the democracy that we find ourselves in. You have to be able as one community to kind of speak to the direction you need to be moving in, even though you're not all agreed on how it should happen.
And then the only thing I'll add to that is you can't always, not everyone's going to always agree. And I think one of the things we found is just being transparent about why decisions were made, what can change and what can't really goes a long way, about just being honest rather than moving forward and ignoring people, because people don't like feeling ignored. So being able to acknowledge the different opinions and why a certain decision was made, even if not every single person agreed.
Yeah, I would just also add that in regards to like the process of selecting our community members was a little bit more convenient in the sense of we had our regional leads, we had our community leads, and it was just a matter of contacting and seeing who was available. But I think the bigger thing in terms of not necessarily solving any like disagreements, it's to one understand that power play really mattered for our process because we knew that we were working with CDPH. We had our community leads and our regional leads in the room, and we understood that there were some things that they were just not going to say in front of CDPH, no matter how, no matter how much they felt like they're empowered, right? And so we had to acknowledge that, and that had to be said out loud. And that was something where we had to also say, like, no, like when we have our AG meetings or when we have to excuse our CDPH representatives so that we can create a space for our community members to speak freely, right? And it wasn't a situation where everyone agreed. I don't think that was ever the case, but as Nancy had mentioned and everyone's kind of mentioned, saying those things out loud, like addressing the elephants in the room, so to speak, and let's just understand what the real status is of what's going on in the community because that truly helps us. And we didn't never ever came out of every meeting with, with a resolution per se, but we at least understood where we were all at, and we then knew, okay, with this all laid out, how do we move forward, right? Like that, like was mentioned, what's the sequential order? What is, the things that we should consider and taking all voice into consideration, what can we compromise? And what are some things that just is what it is? And that was also, a truth that we had to acknowledge that it was an ongoing iterative process.
Thank you all for that. So another important question that's come through, and I think, Jackie, this was during your presentation, but I think you all could speak to this as well. And that is, how were community advisory council members selected? So were there specific criteria they needed to meet? Was there a selection process? Those sorts of questions. And then also a question around how you determine reimbursement for community advisory committee members. So Jackie, perhaps you want to start and then.
Sure. Yeah, so since ours was really in response to the COVID-19 pandemic, we looked at citywide surveillance data to see where there were neighborhoods with the highest burden. And so we used that to prioritize neighborhoods. But other than that, really the requirements were, are you interested? Are you able to commit? Understanding people get sick, things happen, but we don't want someone just showing up twice over the next year. So looking for commitment. And for legal reasons, 18 years and older. Actually, that's not true. We started with youth That is not true. We worked with our legal team and we did have 2 youth representatives at the beginning to get the youth input. Schools were going virtual, so that's actually not true. But other than that, it was really just around community and if they were interested in participating. As for the dollar amount, there was no research or science really evidence behind that dollar amount. We were looking, there are some tax rules around a certain amount per year had to be reported, and we didn't want community members to have that burden. So we were trying to find a balance of we want to pay them sufficiently, but we also don't want to have any administrative burden. Eventually, we had them meet more, and the payment did go over that amount. So we had to come up with some other ways. But we were really just looking for some alignment with other research staff, what that dollar amount per hour would be, and then talked through that with folks. So that's our experience, but others.
Yeah, so in one of the examples I shared, always was a national cross-site evaluation, and the 9 sites had their own collaboratives made up of a kind of lead CBO and community members and partners. And our only kind of ask was, can we ensure that we end up with a diverse group so that we don't have like all lead CBOs represented, and that there would be room at the table for partners, community residents. And even as we thought about, they created, as I said, the charter, there was a little bit of a negotiation between the funder and the group about how much, and the amount that they landed on was really them saying that, well, we think for X number of hours of engagement, we could share the resources amongst ourselves locally. So they were empowered, really. I mean, that resource that was provided, it wasn't like you can only use it to do this. It was really given to the collaborative for their participation as a part of that advisory group. And they created the charter. So it really was up to them. There wasn't, I don't recall doing a lot of research to say, all right, let's see what's happened there. Some of it was just how much could the funder afford, and then what seemed reasonable given that for participation of folks.
I love that. I love that truly community-driven process. Anybody else? Or I have one more question I'd love to get in. Go ahead.
Oh, I kind of already, maybe I jumped the gun. I kind of mentioned the selection process as my first, so I didn't want to be redundant. But in terms of the compensation, there wasn't anything formulaic. It was really just similar to what was already said. The funders really trying to compensate. But we were very, very, I think one thing that I will just mention in terms of the compensation process is that we were very, very aware and keen that we were not going to, and this was something even in the conversation with our AG members, that we were not going to move forward with multiple meetings unless we made sure that they were, compensated at least one time after the first meeting. And that was something that also kind of happened. And that was a process of conversation that we had to overcome, because there were some things slow moving on the back end. And going back to that idea of that sense of urgency, people were like, well, let's still just hold the meetings and we can, back pay them and things of that nature. And they had to be a line that was drawn like, no, we're not holding no more meetings until we make sure that they're paid for at least that first time, right? Just to make sure that we don't create that mistrust that could potentially happen, that things that have happened in the past where it's promised back pay and things. So we really wanted to make sure that, they were compensated sequentially and regularly according to how often they met with us.
Just very quickly, there was one site that actually asked, could they have proxy memberships? So could they have a representative, but just given the fact that things happen, you can't find somebody to take care of your kids, could there be somebody else who might be a stand-in? And that was allowed by the group. They asked whether or not they could rotate out at the end of each year to ensure that there was broader representation from the community. So they created the rules that even more locally allowed for greater participation of community members.
Okay, I know we only have a few minutes, 3 minutes. I would love to get one more question. Maybe this will be like a speed round though, so you all have to answer this in a sentence or less. Well, not really, but with really quickly. So looking back, and was there anything you wish you had done differently that you might consider in your future work?
Related to the last question, I would really ask for, I've been on both sides of this coin, and I think that because of logistical issues, sometimes you compensate the nonprofit for the time of the people in the committees. And I've been really burned where I spent a year of my personal um emotional labor during work hours, and I understand that I'm doing work, but that wasn't clearly like defined for myself where like because in the past I've received honorariums from my job, I thought this one would also apply, but because it was a larger sum, it didn't. And it was a very hard pill to swallow because at the end of the day, the committee was like based on lived experience. And a nonprofit at the end of the day is a paper at City Hall and it's not living an experience. And I think that that's something that I wish I would have done differently when I had the opportunity to compensate community members. I think sometimes to get around it, we would try to give gift cards because I wanted them to leave with something. But I think I would have demanded more from the institutions that were like wanting to do this work, like if people find loopholes for many things, and so I think that human subjects, human people are worthy of finding those loopholes because it's not easy work. It's very exhausting, and it just really like can erode a lot of trust between a community, a nonprofit, like and all these entities. And yeah, I would have done that differently.
Thank you.
And I think mine I'll do really quickly, which is we did bring every single partner together a few times, but we didn't do it frequently enough. I think community funders, grantees, organizations, maybe once a year, but we should have done it more than that.
I wish we'd had a evaluation planning period prior to the scope development. That would have allowed us to sit with and develop a relationship with community so that we wouldn't necessarily be asking for input to stuff that was already created. We'd have co-created from the very beginning.
I would definitely say, similar to what Jackie mentioned, being able to meet. I think the turning point for our process was when we stopped just meeting virtually, and then we ended up having one of our meetings, especially our AG meetings, in person, and we were able to really connect and really get to build interpersonal relationships, and that really turned things around and really got the momentum moving forward. So I wish we would have done that earlier. And I know there were some things at that time, some COVID protocols and things in the way, but I really wish we would have invested more time to really meeting and engaging all parties, like said, in person, and really, start building from the ground up there.
All right. Thank you all so much again for participating. I'm going to turn things back over to Jackie to close us out.
Thank you. Thank you all so much for joining us. To our presenters, Nancy, Kelechi, Chris. This was I learned a lot. I have now lessons learned from your presentations that I'm going to take note of. So thank you everyone for joining. And we will be hosting more webinars. So sign up for our newsletter, follow us on LinkedIn, and we hope to see you soon. Thank you.
Happy anniversary, SUHI.
Yes, happy anniversary. Thank you.
Take care.
Thank you.